Chapter 9, Animal and Tick-Borne Diseases. You like that? Babesia, Ehrlichia, Babesia. And here, leptospirosis is a spirochete, and therefore you can't grow it in regular culture, and you can't see it in a regular culture medium. So it's a spirochete, and it causes basically liver and kidney leptospirosis. It grows, you know what actually causes pyelonephritis in rats? Yeah, leptospirosis, if you have like contaminated food and stuff where the rat urinates on the wrong Mexican cheese and stuff like this, animal urine in particular. Yeah, do you know what actually grows in the proximal tubule of rats? It does, it's rat pyelonephritis. You're drinking rat pee. Rat pee! Yeah, rat pee. And it causes you to have fever, myalgias. By itself, that's not too nonspecific. That could be trichinosis, and altered mental status. What helps you think about it is, in reality, is that it also, let's see it here, it helps you, it's isolated to liver and kidney, a lot of liver and kidney, okay? The person, not just the rat, but the liver and the kidney of the person who gets it. Serology test, the culture is dangerous because it spreads around. And the spores cause pneumonia, lab personnel. That's nasty. Liver and kidney in the host, in the recipient. Now, cysticercosis, you will look for a seizing Mexican. And the person is because when it happens is that a lot of people get infected from contaminated foods and undercooked things and unclean things. And basically what happens is that they get calcified and they show up when they're seizing later on. Now, if it's just calcified lesions and seizing, that's the number one thing they'll want you to know. If it's calcified lesions just presenting with seizures, the treatment is just seizure medications. If it's calcified lesions and seizures, it's just seizure medications. If it has active infections, active worms in there, that's the albendazole, serology, albendazole. And cysticercosis is actually not a very complicated disease. Seizing, people from places where they don't have a good Food and Drug Administration, so the population is not protected from contaminated foods, or you eat at local carnicerias that don't have good hygiene. And if it's just calcification and seizures, anti-epileptics. Don't treat with albendazole unless there's active lesions. The other part is, because as they die, they create inflammation. Here's the other unique feature besides just calcified and seizures. Calcified seizures, seizure meds. The unique feature is, if you're going to treat, remember, if you're going to treat, most people don't need albendazole. If you're going to treat, you give what medication in advance to stop the inflammation? You pre-treat with steroids. Because if cysticercosis dies, it's like a kind of a Jari Herxheimer. Treat with steroids in advance. Now, there's a Lyme target, and for USMLE, camping and hiking is the only clear marker for ticks, because only 20% of people remember the tick bite because it's so small. A rash with a target, with pale center, red ring on the outside. Although the term is erythema migrans, that's not a really great term, is it? It means red skin that moves. However, since it's such a small tick, you look for markers for tick, and the marker for the tick is that people don't remember the tick, so you say, but were you outdoors? Were you up in Middletown, hanging around in the woods, running and frolicking naked in the woods in the Catskills outside Middletown, New York or something, that kind of place? And if you say, well, yes, I was frolicking just this morning with everybody in Middletown off the bus, and you say, oh, do you remember being, did you have unprotected contact with an anonymous tick? And people go, no, not me. I don't remember an anonymous tick. I didn't have any unprotected contact. Well, maybe you did, but it was so small. Yeah, well, you don't expect me to remember something so small. Look at that. You expect me? The finger is bigger than that tick. Yeah, the finger is bigger than the tick, so much bigger. So that's why you don't remember. So you do remember camping and hiking and frolicking naked in Middletown, and it's a target-shaped rash. That you remember. Now, if you have a target-shaped rash, you don't need any serology. Go straight to therapy. Now, here's the other questions. Asymptomatic tick bite, do not treat. Asymptomatic tick bite, do not treat. Target-shaped lesion, go straight to therapy. 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 Now, a 43-year-old man with target-shaped lesions over the last several days was on a camping trip in the woods in Maine. What is next? The next step is straight to treatment, doxycycline or amoxicillin. Doxycycline or amoxicillin. Serology and ELISAs and Western blots, that stuff is what you do when you've got the other manifestations of Lyme. Lyme in the joint, Lyme in the brain, Lyme in the heart, joint, Lyme, joint, Lyme, joint, heart, Lyme, brain, Lyme. Serology. Ceftriaxone is the answer when you have CNS and cardiac. Doxycycline and amoxicillin for oral therapy for rash, joint, and facial. Rash, joint, and facial gets oral. Now, long-term manifestations. Which of those is the most common of the long-term manifestations? And the most common of the long-term manifestations is the joint problem. 60% will get the joint problem. It's much more common than cardiac and more common than neurologic. Now, the most common of the neurologic problems is 7th cranial nerve palsy. And the most common of the cardiac problems is AV block. These need serologic confirmation. Those all need serologic confirmation. IgGs, IgMs, PCRs. IgGs, IgMs, PCRs. Okay, but when you just have a rash, you don't need serologic confirmation because you're always going to treat it. And when you just have an asymptomatic tick bite, you don't need serologic confirmation because you're not going to treat it. Rash, no tests because you're sure it's there, treat. Asymptomatic tick, no tests because you're sure you're not going to treat. If you have rash, joint, and facial palsy, you can treat with oral. The other things, AV block, conduction defects, cardiac disease, the AV block, conduction disease. Now remember, 7th cranial nerve palsy does not count as CNS. 7th cranial nerve palsy does not count as CNS. Rash, oral therapy. Joint pain, oral therapy. 7th cranial nerve, oral therapy. Oral therapy. Rash, joint, facial, doxycycline, amoxicillin, or ceftriaxone. CNS and cardiac, IV ceftriaxone. Our next, isn't that cute? Interestingly, it's the same tick. It's the same tick. Oh, that's beautiful. It's the same tick that transmits Lyme and Babesia. Now, Babesia is sometimes called North American malaria because it causes hemolysis. And it can be severe in asplenic patients. Now, the mechanism of that is that when you have an infected red cell, infected red cells get abnormal bumps on the outside of them. They get lumpy and bumpy. And what part of your body removes damaged or deformed red cells? Why, it's the spleen. And if your spleen is gone, it doesn't remove the infected cells. So the infection spreads. The infection spreads more because the spleen's not there to pull out the criminal cells. Now, in Babesia, it's the same tick that transmits Lyme, Ixodes scapularis, Babesia, and what's the third infection that gets transmitted by the same Ixodes tick? The third infection is Ehrlichia. And you can actually get Lyme, Babesia, and Ehrlichia from one sick tick. Now, Babesia, 10 years ago, I would have told you that this was an infectious disease board question, but not anymore. Same with Ehrlichia. Not anymore. You got to know it. Babesia, you see intraerythrocytic ring forms. This is why it looks to people like malaria. Except malaria is not in by ticks and it's not up in cold places. Babesia is in ticks in Massachusetts. Now, we actually use PCR to make that diagnosis. Look at that. There's the intraerythrocytic ring form. There it is. There it is over there. Now, Babesia, the treatment is azithromycin and atovaquone. Now, some of you might have, if you knew anything about it, may have been thinking about quinine and clindamycin in the past, and quinine and doxy, but quinine's out. It has the same efficacy as azithromycin and atovaquone and doesn't cause the ringing in the ears. That quinine stuff is tough on people's ears. It really is. Now, Ehrlichia is also transmitted by a sick tick. It's also transmitted by the Ixodes tick. And here's the pattern for Ehrlichia. High LFTs, low platelets, low whites. High LFTs, low platelets, low whites. High LFTs, low platelets, low whites. High LFTs, low platelets, and low white cells. And there's the morula, the mulberry. To think that I saw it on Morula Street. Mulberry Street. Morula, yeah, the Mulberry Street. There it is. Let's go back. I like that morula. Ah. God. So the diagnostic testing is a blood smear looking for the morula. Morula, morula. Sounds like a monster movie, doesn't it? The blood smear, you see that? And there's the morula. And also, of course, life is genetic. The truth in the 21st century is genetic truth, PCR. And the treatment for Ehrlichia, it's a rather, Ehrlichia used to be like a rickettsia. It used to be like a rickettsia. It's arthropod borne. It's arthropod borne. And also you can't see it on a gram stain and can't grow it in regular culture medium. So since it was transmitted by an arthropod and you can't see it in gram stain, you can't grow it in regular culture medium, it's treated with doxycycline. So it used to be in a rickettsia. Used to be in rickettsia. There's some more morula. It used to be like rickettsia. Taken out of there, okay? By the way, the other name for that also, remember, anaplasma. Anaplasma sounds like a Greek girl you went out with once. Anaplasma? Yeah, anaplasma is the other name for that. Malaria, you don't have to know too much. Basically, people come in. There's about 1,000 cases that come into the United States each year. About 1,000 cases. There's no domestic. Actually, that's what the CDC started out as 100 years ago. The CDC was originally the Bureau of Malaria Control. That's what it started out with. It was the first national epidemiologic thing. And malaria causes hemolysis. One of the things that people don't understand is that if you don't have GI problems, you probably don't have malaria. Almost everybody has a GI problem, abdominal pain, nausea, vomiting, hemolysis. So that's why you should be seeing a high bilirubin. You should be seeing a high bilirubin. The diagnostic test is still blood smear, still blood smear. It still is, still blood smear. It's a pain in the ass, but still blood smear. The treatment is quinine and doxycycline if it's very severe. The same prophylaxis that you use can also be used for treatment. Mefloquine is both prophylaxis and treatment. Atovaquone proguanil can be both prophylaxis and treatment. But mefloquine is prophylaxis and treatment. Now, you will not be asked to choose between them. You won't. I don't know the difference, really. Sometimes I use mefloquine and sometimes I use atovaquone proguanil because for me, it's like the flavors of Ben & Jerry's. I want to say I tried all of them, even the ones I don't like. So it's my feeling on this, but you won't get asked to choose between them because they're all equal. The wrong answer is going to be clearly wrong, like chloroquine. Clearly wrong. Quinine doxy is for severe disease. Mefloquine, atovaquone, proguanil equal. And doxycycline is an answer for what do you do for mefloquine-resistant plasmodium. Mefloquine resistant. Wowie gazowie. Treatment here, mefloquine is here. What's clear? See, they can't ask you to choose the difference in efficacy. They can't say, well, which is better? Is it atovaquone, proguanil, yes, the same atovaquone as pneumocystis. Malaria, the atovaquone, proguanil, or the mefloquine, well, they're both the same. Oh, well, mefloquine is neuropsychiatric and cardiac problems. Don't use it in people with QT prolongation. That's a clear question, isn't it? That's a clear question. So I'm going to tell you almost certainly the malaria question for you is going to be a prophylactic one. I'll tell you what you don't have to do. You don't have to memorize countries where it's sensitive and resistant. Anybody who asks you to do that is wrong because you don't have to go memorize which of 190 countries in the world, or 189 or 192 countries, depending on how you divide up certain places. No one is going to ask you to divide up 190 countries. Nobody knows. Okay, so you're not going to get asked that part. You're going to be saying a patient is traveling to a country for which malaria is endemic. What should you use? The right answer will be either mefloquine or atovaquone proguanil. Doxycycline is not a first choice, and chloroquine is not a first choice. Now, these disorders here, we're more knowledgeable than we used to be. Medical students routinely know things that I would have considered to be on subspecialty boards before. So in the past, when I originally did Step 3 books, I did not have things like leptospirosis and Ehrlichia and Babesia. But now you got to know it. And besides that, when you go traveling somewhere and you go on your own vacation, aren't you going to want to know?